Good morning. Welcome, everybody. Glad to have you all here safely. This meeting of the Board of Chiropractic Examiners is held at the Department of Consumer Affairs Emerald Room, located at 1747 North Market Boulevard, Suite 184, Sacramento, California, 95834. The date is Thursday, April 16th, and the time is 9:04. The board's paramount responsibility is to protect the health, welfare, and safety of the public through licensure, education, engagement, and enforcement in chiropractic care. Members of the public may address the board during the public comment session. Public comments will also be taken on agenda items at the time the item is heard and prior to the board taking any action on said items. Those who would like to provide public comment will be limited to 3 minutes unless, at the discretion of the board, circumstances require a longer period. Members of the public will not be permitted to yield their allotted time to other members of the public to make comments. Individuals may appear before the board to discuss items not on today's agenda. However, the board may not discuss or take action on these items except to decide whether to place the matter on the agenda of a future meeting. Please be aware that this meeting is being recorded. Please turn off or silence all cell phones. We will now take the roll call. And Ms. Cruz, will you take the roll?
Yep. Dr. Adams.
Present.
Dr. Daniels.
Present.
Ms. Cruz, present. Dr. Azolino.
Present.
Mr. Paris.
Present.
Or Mr. Paris, Dr. Paris, sorry. Ooh, sorry, I apologize. Let me do that again.
I'm bold.
Redo, Dr. Paris.
accept bold.
And Mr. Sweet is excused.
Thank you. We have a quorum. Public comment for items not on the agenda. Do we have any public members that are wishing to make comment? Present?
No.
Seeing none, I think we can move on. All right, thank you. My report. Listen, we've had a great year. We have a great year coming up. Things are getting accomplished. We completed our sunset review. It was exciting preparation and a very easy process. I think we were there for about 13 minutes. So we appreciate all the time and effort the staff put into that. Spent a lot of time on it, so we were ready to go. And fortunately, we didn't have too difficult of a time, and it was smooth. And I think a big part of that was the fact that we had accomplished so much in the previous year and 2 years. And I think that there wasn't a lot for them to comment on. One of the concerns they did express was about as is our concern as a board, is the declining number of chiropractors in the state, and the fact that is limiting access for our people in the state. And so we are hoping to address that. And I think we've done a lot of things through the licensing committee in the last few years to hopefully make that better for bringing people to the state. Kristen and I were able to attend the Cal Chiro's Legislative Day just this past Tuesday on the 14th and present there about information that will help current and new licensees in their keeping themselves abreast of information about their practice and their license, and about the Connect system and how they can access that. Kristen reported that we have about 55% adoption of our current licensees to the Connect system, and about 93% of new licensees that are coming into the state. So Connect is being adopted, which is going to enable us to streamline and be more efficient at the board level when it comes to communicating with licensees and stakeholders and providers. So that's some positive things. We also had discussions there and presentations on some things we'll be discussing later today on animal chiropractic, and and what's happening with Senator Ochoa Bogue's bill that's been introduced and may or may not go to the floor at some future time. So we'll be discussing that. And also, just to wrap up, thank the board for your committees that you've been chairing and the things that have been accomplished in the last year and the things that are upcoming for this year. We still have many of our regulatory packages that we've submitted. I think we were at 22, and we've got, 9, I think, going, that have gone through, and many more that are going to go through this year. So we've tackled a lot of things, and I think there's a lot to look forward to this year, to next year, and the years coming that the board is really taking initiative on. That's my report. I'll leave it open if there's any questions or comments from members of the board. Hearing none, we'll open it for public comment. Is there any public comment? Hearing none, then we will move to item agenda number 4. And we will welcome Lucia Salvador, Deputy Director of the Board and Bureau Relations, to provide us an update on behalf of the Department of Consumer Affairs. Welcome.
Good morning. Can you hear me okay?
Yeah, we got you.
Great. Good morning, board members and staff. My name is Lucia Saldivar, and I'm the Deputy Director of Board and Bureau Relations at the California Department of Consumer Affairs. It is a pleasure to meet all of you. I was appointed to this position last fall by Governor Newsom after having worked in the legislature for nearly 8 years, most previously serving as a chief of staff. And I have been slowly making my way to all of the board meetings, so thank you so much for the opportunity to provide a brief update from the department. Firstly, I wanted to remind members about the upcoming reorganization of DCA's oversight agency, the Business Consumer Services and Housing Agency. This agency will be split into 2 new state agencies, the California Housing and Homelessness Agency and the Business and Consumer Services Agency. The new Business and Consumer Services Agency will be responsible for consumer affairs, licensing and enforcement, and the Department of Consumer Affairs, which will be one of 8 departments under this new agency. These 2 new agencies will officially become operative this summer, July 1st, 2026. And DCA continues to participate in multiple stakeholder meetings and workshops on the logistics required to achieve this transition with the new agency. We will continue to keep board leadership apprised of the transition in the months ahead. Next, DCA would like to remind members and staff that for board business, booking your travel in advance can secure the best rates. Also, evaluate if a rental car is always necessary versus ride-sharing services. We know that there's some new travel costs that some board members are experiencing, such as baggage charges, so please keep receipts so that we can reimburse you timely. And just a quick board member training update. Board member orientation training, also known as BMONT, is an all-day virtual training that DCA offers, and this training must be completed by members within 1 year of appointment and reappointment to their board. We just recently held our first session of the year, just 2 weeks ago, and we look forward to connecting with even more board members for the next BMONT sessions, which are taking place on June 24th and October 21st. Please register for the first available BMONT date using LMS to be in compliance. But if you need assistance accessing any training, or if you're unsure whether you're in compliance, please contact us at memberrelations@dca.ca.gov. And to close, thank you for all that you do to protect California's consumers. I am available for any questions you might have.
Thank you. Open it to the board for any questions.
Thank you.
Thank you so
Thank
much.
you. Appreciate that. We'll open now for public comment on agenda item 4. And seeing none, we will move to agenda item 5 and skip over that because we're tabling that to the next meeting and go to agenda item 6. And review and possible ratification and approval of Doctor of Chiropractic license applications. Any discussion, or I'll entertain a motion?
I'll make a motion to approve.
I'll second.
Thank you. Any public comment? Hearing none. Ms. Cruz, will you take the roll?
Yes. Dr. Adams?
Yes.
Dr. Daniels?
Yes.
Ms. Cruz? Yes. Dr. Aslino?
Yes.
Dr. Paris?
Yes.
All right.
All right, motion passes. Review and possible approval of new continuing education provider applications. Any comments, questions, or entertain a motion?
Motion to approve?
All right. I second.
Excellent. Any public comment? And Ms. Cruz, will you take the roll?
All right, Dr. Adams,
Yes.
Dr. Daniels? Yes. Ms. Cruz, yes. Dr. Azalino?
Yes.
Dr. Paris?
Yes.
All right, motion passes.
Thank you. And agenda item 8, Ms. Walker, you have the floor.
Sure. Thank you. So I'm going to begin my update talking about business modernization and our efforts with the website and the Connect system. So staff is continuing to work with DCA's Office of Information Services on a number of different business modernization efforts, surrounded, centralized with the Connect system, but then also looking broader. We need to update our website and then looking at some of our business processes that still remain largely paper-based and how we can integrate those and see the same efficiencies that we've gained through licensing and enforcement. So to that end, we're working on a few different items. OAS has been working on documenting all of our existing workflows that are in the Connect system to help prepare us for potentially upgrading to a new version of the platform. In having a little bit more discussion though with OAS about what that effort would involve between us and the vendor, we're going to hit a crossroads rather soon where we're going to have to weigh the pros and cons of whether we actually move to that new platform or if we continue with what we have. The reason being we've done our program and then a lot of the other boards that are on what we call version 3 of the Connect platform have really built out custom workflows within that system. So to replicate that in the new version would likely increase our IT costs. So we're trying to, we're weighing the pros and the cons there on if it's in the long run going to make sense for us to invest that kind of money into getting into that platform and making the changes again and paying for them, or continuing with the system that we currently do have. Those talks are very preliminary at this point, but they will be kind of occurring as we head into the summer. So I'll continue to keep the board apprised, and then when we do really hit that point, bring it to the board for a formal vote of which direction we're going to go with that project. So a little bit of more of an update than what we had been seeing in the past, where it was just we were going kind of full speed ahead towards wanting to do that upgrade. Now the vendor is thinking that there's going to be some costs associated with that, so we have to weigh which one we're going to use and how we're going to do it. We also, one of the good things about DCA is they have a lot of other IT resources available within their office. So we're working on discussions there to see which of our workflows actually end up in Connect and what other types of IT solutions already exist in-house to meet our business needs. All of these kind of efforts are centered around continuing education. That's our one major business process that still exists outside of a formal system. We certainly hear the input from the CE providers and licensees on the need for us to integrate that. And then also at the staff level, we need to get that into a formal IT system. So that's really the focus as we head into summer, is finding solutions to both of those issues. And I'll continue to keep the board updated on that. In the meantime, we are continuing with our Connect project. We have a current sprint that's scheduled to end next Thursday, and we're going to implement some new functionality. One of the key pieces that we're doing with that upcoming release on Thursday is we're going to start being able to use the Connect system to directly email licensees or complainants as part of the complaint process. And we're doing that largely in response to a lot of the complaints, or not the complaints, but the scam attempts that we've been seeing that are targeting our licensees, where they're getting a call out of the blue saying that they're under investigation, and if they don't act immediately, their license is going to be suspended. We want to move our communications for enforcement onto the Connect platform, so that when they receive a notification, we can then get the messaging out there that you can verify the legitimacy of the contact by simply going into the Connect, and you'll see a copy of it right there in your profile. So it's kind of one of our ways that we can kind of beat the system there and really protect our licensees. We're also working on some other kind of minor updates to the system, one of which is being able to link accounts to enforcement cases, because right now those two systems exist separately. We're going to integrate those two together so that we're tracking data there. And then we're also preparing to transition to the postcard renewal reminders starting in July. We did float that idea a bit during the Cal Cairo Legislative Day, and mostly well received. A couple licensees that still want the paper, but for the most part they got it. They were kind of excited about Connect, and we'll continue to get some messaging out there so that licensees use the system. I've got some data in the meeting materials as far as our utilization rate. As Dr. Adams mentioned, Our initial applicants continue to lead the way. They're really around about 93% of an adoption rate for our Connect system. And then we expect that our existing licensees to follow, especially once we implement those postcard renewal reminders. Any questions on IT before I talk about other items?
One quick, I'm sorry, go ahead.
When do you think the integration of the enforcement and the Connect system would happen?
So the ability for us to be able to message licensees, that functionality is actually being released next Thursday overnight. So by next Friday, the 24th, we're going to have that functionality in place.
Okay, and then when do we need to decide on the upgrade?
Likely, if possibly the July meeting, but definitely by the October board meeting, we'll have that as an agenda item for the board to discuss with associated costs and
Okay.
Our analysis.
And I don't need them right now, but you have I assume you have an initial sort of thought in your head as far as pros and cons?
I'm right in the middle right now because
Okay.
there's definitely there is the pros and the cons because we had initially with the Connect system we had held back a little bit on what we were going to develop, thinking okay we're going to get to this new platform and then we'll just develop it there, and then that timeline, as we know, kind of was extended. So
Yeah.
then we started developing custom in the version we're on. So now we're kind of at that crossroads. It's do we
Yeah.
and we're actually seeing a lot of improvements with the vendor, really taking a lot of our asks and actually implementing them.
Okay.
We used to get a lot of pushback, and it would say, oh, they couldn't quite accommodate it.
Right.
Now they are, so it's more costs associated with rebuilding it again.
And if we don't do the upgrade, is the platform that we have, is that still maintained by them?
Yes.
Okay,
Yeah.
that won't become like obsolete?
We're
or-
gonna confirm that, but it shouldn't because there's 3 other DCA programs that are also on that same platform
Okay.
and with different opinions on whether they're planning to upgrade at all.
That might be a question to push them on to make sure, because they may say no now, and then
Of course.
A year
later they're
later.
like, oh, well, it's not worth our time.
Right.
Okay,
Yeah.
that's all I have.
My comment was just you kind of already answered a little bit of it, but is upgrade or not upgrade, is that going to impact some of the efficiencies that you're foreseeing for CE and the movement? Would that movement of that platform, is that part of helping streamline and make the CE more efficient so that, so help costs?
That's a good question. There's solutions, I believe, available in both systems. I know for a fact there's solutions that we have envisioned in the platform that we're on currently. The acupuncture board actually already has that full process built out with CE providers and courses
With
and
the
approval.
current- with the
Yep,
current.
syncing with the website and everything. So it's a matter of we know it exists in the version we're on. Very likely would also fit the new version, and then. But then DCA's OIS has a few ideas as well that, maybe it's not so Connect heavy and they've got some other tools that they can use to
Okay.
also help us.
So we may be able to accomplish our goals without having to incur those increased costs?
Correct, yeah.
Got it. Okay, great, thanks.
A question I have, you mentioned kind of the amount of kind of customized workflows. I know whenever you hear the word customization with an IT application, it puts you in a corner. So I know kind of you and the team over the past kind of in your time in your leadership role has really looked at the existing processes to make sure we can streamline where we can. I imagine the level of customization that was put in is really related to the governance around like things need to be kind of checked off, or when I hear customizations in IT, it just worries me. And so.
So, and to give you a bit of assurance there, when I talk about customization, it's more of the things that we need to be able to do our licensing and enforcement functions that didn't come out of the box from the vendor, so they had to custom build it. So it's functionality that we have, but then also like the engineers board uses in a similar
Okay.
manner. We do keep those things in mind though, because when we're implementing things like new applications,
Yeah.
we don't try to over-engineer it to where if one of those factors changes, then all of a sudden you have to rebuild the whole thing.
Yeah.
We try to keep it broad enough that we can just simply refine.
And then, let me see, reasons to not, oh no, and you already covered kind of ongoing future support. Okay. That's okay.
Go ahead.
And then another, I just wanted to quickly highlight, just because there's legislative deadlines coming up rather quickly. So we're in the second year of the 2-year legislative cycle. So all bills that are currently pending out there, they must pass their policy committees that they were introduced in the House, that they were introduced by next Friday, April 24th, or they're dead. And then they then have until May 15th to get out of fiscal. So those are two pretty close deadlines coming up, and that's part of what Dr. Adams was kind of mentioning there too when we were looking at the animal chiropractic bill, which we'll discuss in a little bit more detail 2 agenda items down, but it does need to meet that deadline, or it's essentially dead for the session and would have to be reintroduced in a new session. Dr. Adams covered the outreach that we did. I do have a good personnel update to share with the board. So I'm happy to report that Angelina Taylor has been selected for our lead administrative and policy analyst position. That's a position that's been vacant now for quite a while, but that's the position that's primarily charged with serving in the role as the board liaison, handling kind of a regulation specialist type role, if you will, and then providing support to the Government and Public Affairs Committee. So her first day with us is going to be on April 27th. We're really excited to have her join us. She's got a lot of experience in the private sector in sales and management. So state service is new to her, but based on our kind of discussions, I think she's going to be a great fit. We're also still working to refill our last remaining vacancy, which is an enforcement technician position. We likely will have that filled early summer. I've also got within the meeting materials just some program statistics. We're seeing the same trends, which I'm happy to report, is that when it comes to licensing, we've been keeping our processing times rather quick. I was happy to report when we were at the Cal Chiro Legislative Day when they're asking us about timeframes. We're really at the point where when somebody files an application, if it's taking them a while, it's because they forgot to submit something. We're practically at the point where staff is reviewing applications the day they were received or the next business day. So our processing times are quite impressive for our licensing applications. So just want to acknowledge staff's hard work there and kind of keeping that going. When it comes to our enforcement side, similarly, they've been doing a lot of work on their pending complaints and getting those numbers down. I had initially shared a goal quite a while ago about having, at the end of this fiscal year, I wanted to see our pending complaint number down to 175. We're hovering right in the 180s, so we're very close. So I'm very happy to see that, and definitely want to give acknowledgement to enforcement staff for their hard work on getting that issue addressed as well. When we first went into the sunset kind of review period that we're concluding, our pending case numbers were in the 500s. So to get down under 200 is crucial, and it's really going to help drive the requests that the legislature has been making that we get our processing times down. It's less cases, you can process them faster. So really wanted to thank staff for their work in that area. Any questions on any of those items?
For me, question on kind of for both both tables for enforcement activity. I'm looking at fines assessed, fines collected, as well as cost recovery ordered, versus collected. I imagine, at least for the initial one for fines, it really kind of is pending the payee, right, on that side. I'm wondering if there is kind of any reason, just right. Some years it's at least relatively near what we're assessing. The last fiscal year, it definitely wasn't. So is there any kind of thing you see staff is running into with that?
It has to do with the focus being on closing the pending complaints. We've kind of accumulated a bit of a workload there of citations that have yet to be issued. So we're actually going to see that spike going into April, May, and as we kind of round out the fiscal year. So we do expect to kind of end, when we look at like fines assessed and collected for this fiscal year, you're likely going to be close to about 40,000. You're actually going to be looking similar to what we did in 23-24.
Yeah, I was
it's
just
a matter of getting those documents out, written, served, and those actions taken.
Okay. Great, that's it.
Okay. Cool. And then as far as legislative items, so we've got 3 regulations now in the final filing phase. The delegation of certain functions to the executive officer, that public comment period ended on March 9th. We didn't receive any comments on that proposal, so we closed the regulation file, and then it was submitted to OAL on March 23rd. So that one's pending their review. Then we've also now closed the practice of chiropractic prohibited with an inactive license package. That public comment period closed on March 23rd. We didn't receive any comments, and then we closed the regulatory package, and it's currently being reviewed by DCA so that we can submit to OAL. we do anticipate that'll likely take place by the end of this month. We also similarly just closed the repeal of mental illness regulation package. That one, the public comment period ended on April 6th, and again, no comments were received. We closed that package, and again, it's pending DCA review. Likely will be also over at OAL by the end of the month. We don't currently have anything in the initial filing phase. A lot of our focus has been on our sunset bill and preparing for that hearing process. So we are, accumulating and still have a number of items in the production phase. We do expect those to move into initial filing as we get into the summer months, especially now that we're bringing on a little bit more support specifically for regulations. So we'll get those addressed. Our number of total pending regulatory proposals does continue to go down as we do complete. So we're currently sitting at 18. As far as in the production phase, the one I wanted to highlight is the fact that I'm pulling out the continuing education requirements for the petitions and running it as a single issue proposal, just like we did with the distance learning, so that we can move it while we address some of the issues with, or I'd say the improvements to continuing education that are also tied to our sunset bill, so that we can move one idea while our sunset bill is in flight. With that being said, we also the concept phase. The board's making quite a bit of progress there. Most of these concepts have been discussed multiple times by the committees. We're getting really to that language phase, and then we're going to start seeing, as we head more into fall and the end of this year, you're potentially going to start running out of concepts, believe it or not. So any of those new ideas that you have are things that we want to work on. We have strategic planning later today, so we can discuss those, but we are starting to get to the point to where a lot of those regulations are more shifting to staff and to carry out, and less at the board discussion level. So any discussion on or questions on regulations? Okay. That concludes my update this morning. So any other questions that you can answer them? Otherwise, I'll turn it right back over to you, Dr. Adams.
Thank you.
Any questions, any comments from the board? Any public comment? Excellent. All right, we'll move on to agenda item 9. And this gets us to our asks
Yes.
of the legislature, which is, I think, a nice process that we're moving forward on very well. It looks like we're going to probably get most of our asks potentially.
I will know more later today
Yeah.
when we talk.
Great.
So I want to do basically two things with this item. So we had our sunset review hearing on March 10th. As Dr. Adams mentioned, during the hearing itself, a lot of the questions were focused on our licensee population. We did receive a question or two about our ask with expanding our authority for denying a license for prior professional discipline related to sexual misconduct, and then some questions around our budget and fund condition. I've got a draft of the BCE responses to the sunset issues within the meeting materials. What I'm proposing to do, and what I would like to do, is I've got some policy questions for the board to discuss. So I'd like to discuss those today, and then to allow for a bit of time to integrate the policy direction into the response, and then allow the board to review what we have. I would like to take the formal vote to approve the responses tomorrow morning before we do the petition hearings. Would that be acceptable for the board?
Yes.
Okay. So I'm gonna kick it off with the budget. What I'm recommending that the board do on the budget is we were basically being asked. It's that same question. Okay, so every sunset review for the last 3, the board's coming back and needing a fee increase. Why? And what are you going to do to address it? One of the issues that there's a few reasons leading to that. One of it, but the biggest issue with it was at our last sunset review, we unfortunately our fee audit report that we brought forward was based on 2020 data. But yet we were using that fixed cost and implementing it in 2023. So even by the time we passed our bill, we were already 3 years behind, and we just couldn't realize a lot of those costs that we were expecting there. So instead, the strategy and my recommendation for what the board should do moving forward is I've been working on an analysis that I'll integrate into this response, but the board needs to, as I've kind of got spelled out there in the way the language looks, reestablish the floor for each fee amount based on just, the increases that we have in costs over time, and then establish a new ceiling. With my recommendation is let's request a ceiling that's going to sustain us for 10 years into the future so that we have movement there, and we're not fixed like we are now. And then on top of doing that, we also so you establish the floor and the ceiling, and then the other recommendation is going to be that we request the new fee authority through this bill that we have in there. And then we do need to account for some of the efficiencies that were gained in continuing education, and also the initial licensure process. So those fees will get adjusted just a little bit, but basically take a baseline adjustment and account for our current costs. But what my recommendation is actually to account for 26-27 costs, because that's when the bill would become effective, would be January 1, 2027. Use that as your baseline, and then project out 10 years to your max and make that the request. And then beyond that, the other request, which it's separate from sunset, but it's my recommendation to the board, is that we maintain that system by at least biennially reviewing our fee amounts and moving them incrementally so that we don't continue having to make these big leaps, because I know that the burden that puts on licensees, it's very difficult to try to plan out your transactions when we're moving at that kind of level.
Which from our communication, if we have the base and then we have the, thinking projections out, then we don't have to keep going back to the legislature for ask. We can do it through regulation as appropriate.
Exactly. What the language would do is it would allow us that January 1, 2027, it would reestablish our bottom fee amount. So then staff can go in with like a Section 100 regulation change and just simply clean up our regulations with the new bottom starting fee amount. And then as the board projects the need to increase them, you're doing that through the regulation process, and as long as you're not going to hit your cap, and then you would work with me and DCA, and we would put together an analysis and pick those numbers. The only other recommendation that varies with this is that my other recommendation is with the challenges that CE providers have had with continuing education courses, my recommendation is so we've done an analysis as far as the current cost of what it costs for us to approve a course application, and it's actually rather close to that same $116 an hour fee that's currently in regulation. But that cost is largely driven by inefficiencies that we're hoping to, or that we are going to address through our Connect and other IT improvements this year. So instead, it's recommended that we change that fee amount down so that we're only charging for what's truly should be a staff cost associated with it, and not charge for the overhead and the inefficiencies. So if the board's agreeable to that plan, I'll get this amended and presented so that we can discuss it. But is there any questions on fees or kind of that idea there?
Yeah, I just wanted to question, but comment, just agreed and relieved that we finally have a plan for looking to the future instead of playing catch up all the time. So I'm happy about kind of the 10-year outlook, and then proactively looking at our fees every couple years. And just more of a caution. I mean, I trust you and the numbers. Just, I know we've talked about it privately, just really making sure we don't undercut what our current fee, what it currently costs us, and to be kind of really on point with that, because otherwise we're undercutting our costs again. So just a concern there. And then is the facility permit ask in here, or is that later?
It is. So in that language there, what I'm proposing for language is we've got our initial fee schedule, if you will, and it was kind of, the wording on it was a little bit odd, so I kind of changed it into sentence form with the floor and the ceiling.
Yeah.
And then when you get into starting with subdivision B, I put some language in there about just retaining the board's authority to adopt a lower fee if for some reason you realize some efficiency and you can actually drop the floor.
Mm-hmm.
They would have that, and that's in the current, or that's in our current language, but I just moved it to a separate section there.
Okay.
And then subdivisions C
Oh,
and
there
D
it is.
include
Sorry.
the new fee authority there.
Okay.
So We put language around may establish so that
Yes.
it's not, you're not required to do it, but you have the authority to do it.
Okay.
And my recommendation is to, so that we're consistent with our messaging and our request around the chiropractic facility permit, is request authority to charge a reasonable regulatory cost that's not to exceed the limits that were established for a satellite certificate. And then for the temporary license, tie it to the cost of issuing a regular license. So you can't exceed that amount, and then we would calculate it and implement
Okay.
it through regulation.
Yeah, perfect. All right, thank you.
Did you want to give any insight, Kristen, as to where some of your approximations on some of these fees? Because if we're going to need to, as a board, because we have to get this in the bill here pretty soon, correct?
Correct, yeah. What we're finding is, so for the majority of these fee amounts, they're going to be very close to what they currently are, and then just adjusted up. You're talking about like 3 to 5% to account for the increase in costs over time. The one that's more significantly different is the DC license renewal fee. The problem is in the prior analysis, we tried to put too much of the overhead cost into continuing education, and that's just not where it fits. So that DC license renewal fee, unfortunately, the floor there is going to be pretty close to $400
Right.
when it's all said and done, and it's going to grow. The rest of the fees are pretty consistent. And then, like I said, continuing education, that course approval process, there's a lot of different steps in the process that we could turn over to the providers and have them do it themselves, so we're not incurring staff costs, and we could redirect.
Right.
So that's where the recommendation on dropping that fee is coming from.
So what's our timeline? Do we have to get specific things in here like today with us, or is that still kind of pending with your internal evaluation?
So I would like to get a vote tomorrow on the actual. I just want to make sure the board was okay with this plan so that I can finalize this document for
Yeah, I
review. We'll
think-
do another discussion in the morning. I just
Yeah.
wanted to make sure there wasn't any problem before we plug in numbers. I didn't want to put something out that the board wouldn't agree to.
Yeah.
And we want to make sure that we note for the public that we are moving the action item number 9 to tomorrow morning.
Okay.
It is not noted. Yeah.
Oh, yeah, thank you.
Just
Thank you.
everybody present
Yeah.
and watching from home.
Yep.
Do you need me to make that announcement now, or
I think what
She just did.
I just
you covered it?
I did
Great.
it.
Excellent.
Oh, I do have one last question. When you were talking about kind of moving some of the back work to the providers, do we have a sense, or have we reached out to their ability to step up and do that, their willingness to step up? I just don't want to get into, you have a small provider, you have a lot of small providers, and they don't really have that capability or ability to, and then we are incurring the cost of doing that back work. So just,
We're intending to design the system in a way that it's very accessible and easy for anybody, no matter size, to be able to manage it.
Okay.
At this point, we've only had more preliminary discussions with the larger providers, and they've had no issue with it.
Okay.
We will engage in those as we
yeah, just
design
want to
the
keep
system.
those
Yeah, we want to get there.
in mind that, yeah, okay.
Yeah, of course.
All right. I don't have any other questions.
Okay. So then, moving on, issue number 2 kind of builds on issue number 1. That was just around the chiropractic facility permit. The only item there that I wanted to note was we did do an analysis of the current licensee population of active satellite certificates compared to how many people are at each of those addresses. And basically, we've got a little over 7,000 active satellite certificates between the ones that are being renewed and the new ones that are coming online with us. We identified just about 3,700 distinct practice locations spread across those 7,000 certificates. So we did find about 2,500 locations that are associated with just one licensee, indicating they likely stay on that satellite certificate process. But then we found about 1,100 that are associated with multiple licensees. So it gives us a little bit of an insight of when we do get to that regulation process and we're looking at a chiropractic facility permit versus an individual satellite certificate, you have a general idea of what your licensee population would look like.
Good.
Yeah, I'm trying to, do we have any sense of what the business model is, or what is going on with one licensee requiring 2,548?
Oh, I'm sorry. 2,548 only have one. It's per 2,548 individuals with just one address associated with it, not one
With
person
one,
that's got
one
2,500.
location,
yes.
not, oh, okay.
Yeah, yeah,
Okay,
yeah.
I
yes,
read
yes,
it,
yes.
I read it,
Yeah.
two,
No.
are associated with one licensee.
That's a corporation.
No.
We did though identify a handful of addresses that do have 30 or 40 licensees
I saw,
associated with
yes.
them, and we'll be looking into that to try.
And that was my next question. Do we have any sense of what is happening at these different satellite locations? Do we have, when they apply, can we actually put that down on the questionnaire so we have a sense if they're practicing, if they're just doing QMEs, or what they may be doing?
We don't know that we included that in the satellite language, but we might want to look at that. Because we did clarify the current process, and we did define that, they have to have a satellite if it's a QME or if they're actually, practicing there. We could potentially add that as a another data point that we
I think
gather.
that would be very helpful, and it'd probably help our enforcement committee quite a bit.
Yeah.
Because if somebody's running multiple different locations, the question is, what are they actually doing at all those different locations?
Right, yeah.
And then also, what about the QM, it's been a while, but I know there are companies that hire QMEs and they set up the location for you, and that varies almost every time you go to do one. So how would those providers, establish that address in the short time that you get a notification with an office location to go do a QME at?
So they typically, they have to register that ahead of time so that they can get access to lists. So what those people actually end up doing is those individuals get a satellite certificate that they maybe use once, but it just maintains for every year. But it'll be like one address that 25 different licensees or 50 will flow through in any given time. So the idea is that when you eventually shift to the facility permit, someone's going to be in charge of that facility, and then they're maintaining it, so that we have data around that specific address, and we know these people were associated to all these dates, rather than having some mix of 25 to 100 satellite certificates.
But how do you receive, and I don't want to name a company per se here, but
Yeah.
how do you receive the information from the company of where they've sent DCs to rectify that those actually have? In other words, when I did this, you got a location, they found an office somewhere that was a separate, might have been a chiropractic office, might have been a medical facility, and you would meet like an MSA there that would help with the, getting you set up and whatever, and they basically rent or lease that office for very short periods of time. And it was never really the same location, and sometimes it would be a brand new one in a different city because you got pulled to do one in Chico, or for me an hour away in Chico, California.
Right.
So how are you getting that information to know that they actually had? I'm trying to think of how that DC would even have the time in that short 60-day notice or whatever to actually do that. I don't know that they're doing that.
They are, because they're being required to do that for the QME program. So what we're seeing is we do see quite a bit of those companies that are running those programs trying to submit a very high volume of satellite certificates, and then obviously requesting expedite these because they're trying to get people online and in the system. But then we're basically cycling through all these satellites that then go into forfeiture and never get renewed because, like you said, they're kind of used for a temporary purpose and then forgotten about. The idea around the facility permit would be that it would allow you to be a little bit more fluid there, where you're not having to issue them each time to each individual. You can just maintain it.
Right. So your sense is that they are in fact notifying the board, getting a satellite certificate currently, and even to do one eval at one location.
Because they're being required to by in order to participate in QME. So
the DWC is enforcing that on the companies that are.
Yes,
that are
because
doing
they're requiring either a copy of the satellite certificate. I believe they're not even accepting, in a lot of cases, our online verification. We're forcing them to give them a copy of the certificate.
Thank you. That's helpful. Thank you.
One last question here, Christian. I haven't looked at the satellite language in some time, but is there any verification process that we're actually dealing with a brick and mortar place and versus an address?
Not currently. That's something that I'd like to do more with, especially now that we have more of AI. It's it can tell you where to search, and it can do a lot more than just individually looking at addresses. But no, at this point, the process is just they're submitting the addresses and certifying that it's practice address and they're getting a certificate. That's one area that I do want to improve.
How about simply just putting a disclaimer or a statement on there, an attestation that it is a brick and mortar when they sign up, put the burden on them.
And I believe we may have, I'll have to double check, but we may have addressed that in the new language for the regulation that we're working on, because we did put in definitions of what you had to apply for a satellite. And I know, a temporary post office box was not one. So I'll double check, but I think we might be addressing that.
Thank you.
Thanks.
Kristen, can you remind me of the conversation we were having, and I'm not sure if it applies here, we were talking about increasing or leveraging our authority to pop into addresses and see what's going on. Can you remind me of that conversation?
Yes, that's one of the areas that I want to see expand, especially as we kind of turn the page into the what's next. Is I want to establish a much broader inspection program than what we currently have. We have inspection authority, but we don't utilize it in the manner that we potentially could. And now that we're in a position that you can get better data faster, it gives you a better idea of where to look.
I'm just wondering if it ties into our conversation here, as far as making sure it's a brick and mortar and kind of what's going on there. I know we talked about it in regarding marketing and that sort of thing.
Yeah, it certainly fits. One of the, and it's not necessarily that I'm saying that it's something the board would have to consider, but we don't have a lot of language around the actual facility itself and what has to be there. So we have inspection authority, but it pretty much extends to verifying the address is on file with the board and that it's properly, there's a license on the wall. Potentially an idea for later during strategic planning is, does that need to be built upon or not? Is it sufficient? But we don't have a lot of, when you look at, on the opposite side, if you look at the veterinary medical board, they have very extensive regulations, but that's because their licensees are running animal hospitals. So is there somewhere in between, or are regulations sufficient? Maybe a future discussion item for the board.
Great, thank you.
Issue number 3 isn't going to feed into our bill. It's just flagging an issue with our backlog of continuing education audits. What's really going on there was that when we implemented the Connect system, we implemented a manner for us to collect really tens of thousands of CE records, but with our staffing issues, it's not collected in a manner that you can automate it. So now we've accumulated a backlog of tens of thousands of certificates that have to be manually reviewed. So we are working to address that, and we'll provide updates to the legislature on that as we get through that process. What we are finding when we do the review of those certificates, though, is since they were actually uploaded into Connect at the time of renewal, we're seeing an incredibly high compliance rate because people weren't trying to fake us out or say submit a fraudulent document or a picture of something and it wasn't actually a certificate. So the good news is that we've got a really good compliance rate coming out of that. The bad news is we set up kind of a system that we weren't necessarily prepared to maintain. And that's a lot of the reason why we eventually turned off that functionality and we made it optional for licensees. And then we're having conversations with CE providers about instead moving to primary source verification. Rather than us trying to hunt down and search each certificate and double check, let's go right to our providers and ask for the list. So tell us who went to all of your courses within this amount of time and build an IT program that's just gonna put everybody in the columns and tell us who passed and who failed. So we know where to look. So issue number 4 related to national examinations and statute. The committee staff was just kind of questioning the board's use of DCA's Office of Professional Examination Services to do the review work for the National Board of Chiropractic Examiners. I worked with DCA's OPES chief there on a response to that issue, and taking a perspective of, while we're doing the occupational analysis at the state level to justify the state law and ethics exam that we're doing, that national exam review is actually very valuable for us, and it's cost effective because it's really serves as a watchdog to make sure that the national exams that we're requiring for licensure are still fitting California's standards for examination, for scrutiny. So we've got kind of framed there a respectful, this is what we're doing, this is why we do it. We'll continue to keep the committees updated, but nothing very, nothing as far as recommending any changes to the current process at this point.
Well, and when we talked about the numbers, it's a nominal fee compared to our entire budget, so.
Correct.
Dropping that doesn't make sense.
Yeah, our average is between about $26,000 to $34,000 to do those, and we do them on a 4-year or a 5-year cycle.
Right.
So it's relatively minor
Yeah.
in the grand scheme of our budget. And they did, that wasn't an issue specific to BCE. We did see that in all of the DCA boards that were going up through sunset review, they were all being asked that same question, so it's not unique to us. Issue number 5 just had to do with the development of the Connect system. Just a response there. The staff was just requesting that we continue developing it and update them on our progress. So just got a response there, outlining the steps that we're taking. Nothing controversial on that one. Issue number 6 as well had to do with our position vacancies. They're just kind of pointing out some of those issues. As we know, some of those were driven, it was going in cycles, but we had, initially the issue had to do with recruitment, but then it became necessary to kind of salvage our budget over this last 4-year cycle. Now as we're kind of turning the page and moving into a new sunset review, we have been filling the staff positions and we're pursuing the fee authority. So I've just got a response in there, just updating them on the fact that we've filled the positions. Issue number 7 has to do with emerging technology and if BCE is prepared to address the impacts. The short response there is yes, the licensing committee's been doing a lot of work in that area. So just kind of outlining that work that's been done. And then also at this point, no, we do not need any legislative assist there, but we'll let them know if any need arises. Issue number 8 has to do with enforcement timeframes, and the committee staff, again, recommending that we continue working on how to decrease them and continue with an update. We certainly agree we've made progress, but we've made more progress there on the case load, not necessarily the case timeframe. Also pointing out that some of the efficiencies that we're requesting through the enforcement process will help us keep timeframes down. Like we have specific examples of cases where someone has a multiple insurance fraud conviction on the record, and it requires a mandatory revocation, but yet it takes us 2 years to do it because we don't have the automatic authority that we're requesting through sunset. So we're going to do what we can internally to address that, but then also looking for a little bit of partnership from the legislature so that we can address that issue. And then issue number 9. Apologies, the document froze there. Okay. Issue number 9 is the request for being able to deny licensure for formal discipline that involves sexual abuse or misconduct, removing that 7-year limitation that's currently in effect, just kind of expanding on that request and then putting the language in there. The key thing with the language is you see it's a little bit different than what the medical board has, and the reason being only section 326 relating to sexual abuse, misconduct, or relations with a patient applies to BCE. We're not included in section 729, so that's why it's broken out there in the proposed language. But we'll work with committee staff on however they want to word the request, but that's why you see it kind of broken out instead of just saying, say physician, surgeon, or chiropractor all lumped together. The enforcement program enhancements, we've also put together some language there that we're going to include in our request. So the board's discussed these requests a number of times. We've basically got it would be 3 new statutes because you're combining, when you talk about automatic revocation authority, it would be for either the second insurance fraud conviction that carries that mandatory 10-year license revocation period. We're requesting that they give us authority to be able to just automatically implement that and not have to go through the current process that we're doing. and then also extending it to include convictions for sex offenses. So putting those two together in the same language. There is language there. It very closely mirrors what the medical board already has in place that allows it allows the board to take the action immediately, and then the licensee can follow behind and request a hearing if they want to contest that action. But by doing it in that order, we get the public protection that we need immediately, and then they can, they can fight it out through the appeal process, and then if necessary, we would make a change to that provision. We've also got language similarly for addressing being able to automatically suspend a license following conviction of a serious felony as defined. And it's, again, following that same language that the medical board has. The new language has to do with our request for the automatic imposition of a chaperone requirement when there's a pending criminal or administrative proceeding involving either a sex offense or sexual misconduct. This is one of those issues where we would be the first through the gate making the request. I'm not familiar with any DCA programs that have this type of language, so we're gonna ask, and we'll see if we can get it granted there. But the way that language is drafted, it would allow us to automatically order and impose a license restriction requiring a third-party chaperone present while consulting, examining, or treating patients. Under the following circumstances, it would be a criminal complaint, indictment, or information against the licensee charging a violation of a sex offense, or when the board has filed an accusation against a licensee alleging that they've committed an act of sexual abuse, misconduct, or relations with a patient in violation of Section 726 of the Business and Professions Code. I added some language in there to allow the board to have discretion, depending on the nature and circumstances of the proceedings, to either impose the license restriction for a specified patient population or for all encounters. Put some language in there ensuring that the chaperone doesn't have any type of personal relationship with the licensee that would compromise their ability to give us impartial and unbiased information, and then allowing it to keep in effect, giving them the right to a hearing if they wanted to contest that action, and then language for us to pull it back if the proceedings against them were dismissed. Interestingly enough, with this one, as we were looking at our pending accusations that we currently have today, we have 31 that have been filed, and unfortunately 14 of those cases would qualify under this language, surprisingly. So almost 50%, unfortunately, of our current workload right now is around sexual misconduct, and I know that's going to be one of the, that's some of the questions. It's like, well, why are you asking? That's why. There's too many. And there's the challenges with us trying to get an interim suspension order just due to the way that proceeding works and the evidence that you have to show your cards up front makes it difficult for us to get that. And then the PC-23 process has also been changed over the past decade to where you have to wait until a preliminary hearing to try to get those types of restrictions. So what this would do is kind of put us in a position to where if we've investigated a case and we've found sexual misconduct, it's been reviewed by the Attorney General's office and they've agreed to file an accusation, you'd be filing an accusation and imposing a chaperone requirement while that proceeding is pending. And we'd also have the similar ability if we receive a arrest notification and somebody's been charged with a sex offense, we can work with the Attorney General's office to automatically impose that requirement. So like I said, this is probably the biggest ask that we're putting in the sunset, in our sunset request, just because we're trying to do something that nobody's done yet. So we'll likely
I'd like to say thank you for doing that. It's probably the biggest issue, and it should be the biggest ask because
Yeah.
it's the most notable thing that we've seen over the last couple decades.
Yeah.
So thank you.
Yeah.
Okay. Issue number 11 had to do with, this was more of just a last minute addition that we put in our sunset report was around, so the FBI is beginning to do like a wrap back service where you can get subsequent notifications at the federal level. We've had that in place at the state level for a number of years, but the FBI is now going to implement something similar. And the challenge is that the DCA boards, all the DCA boards language that currently authorizes to receive arrest and conviction information isn't necessarily sufficient for us to be able to participate in that wrap back service when it comes online. So we had included a request in our sunset review to potentially put some language in our bill. The response from committee staff is they may have a different vehicle that could address all of the DCA boards and work with us offline on that issue. So board's response is certainly yes. We just want to get it included, whichever way committee staff thinks is best. So we'll continue to work on that issue, but we're very unlikely to see it in our actual sunset bill. The biggest discussion item that I have before the board has to do with animal chiropractic. So we didn't raise this issue in our sunset, but with the bills that have been, the two animal chiropractic bills now that have been introduced during this session, there's a long history with animal physical therapy that's been going on. We had the informational hearing in August. Committee staff has been asking the questions around animal chiropractic and actually incorporating that potentially into our sunset. So what I really need from the board is some more clear direction on what our position is on that issue, so that I can work further with staff on it. It's kind of one of those where it's like we've kept a very neutral but open to collaborative kind of messaging around that issue, but I think we need to fine tune that a little bit into like maybe specific asks. Like I don't want to call it a wish list, but of the different models that are out there, if I could just get some general direction from the board, if they're either open or no on different models. And like specifically, when you look at animal chiropractic, you have bills right now for direct access regulated by our program. Like, is that we're open to collaborate? And then you can, within our sunset report itself, the committee staff kind of expanded on that and instead was proposing, well, what about a physician assistant model where the DC has a practice agreement with a vet and then there's certain parameters in place? Is the board agreeable to that or not? Who would regulate it? The veterinary medical board or us? Like, I'm looking more for just general guidance and kind of preferences versus like the absolute no's, so I can kind of refine this issue a little bit further and get the board's messaging across. So that one I am going to kind of turn back over for board discussion on animal chiropractic and how we kind of feel about those issues.
Yeah.
Shall we have that discussion now? Or?
Yeah.
Yeah, that's what
Yeah.
she's asking.
So let's do it. Comments, thoughts, feedback for the staff and for Kristen relative to this. I'll just say one thing. I kind of have I think it's appropriate for us to at least hold the line on we should be addressing our licensees when it comes to this particular situation, rather than turning it over to the vet board. As far as where the decision is going to come down on direct access, I think we just need to just maintain an open, collaborative aspect, but that when it comes to our licensees, whatever finally is decided upon or agreed upon, whether it's through sunset or whether it's through legislature, that our board should maintain oversight of our licensees. Because I think we have the safeguards in place with the two primary regulatory boards that are kind of dealing with that internationally as well as our California.
Mm-hmm.
And the hours and other things that they have in place. Based on just hearing that presentation on Tuesday, I think they've got some good things in place for oversight, which would be assistive to us as a board.
Where are things sitting right now? What are they proposing? Do we have different models that has one been vetted more than the other?
They're right now. So you've got the direct access bill that Cal Chiro has presented. That one has not yet been scheduled for a committee, and that would have to make it out of committee next week. Then you have within our sunset and wanting to have that discussion, the committee staff is recommending a model similar to a physician assistant, where you have a practice agreement with a veterinarian that's going to establish the supervision requirements and the oversight and the emergency procedures. But as it currently stands, that practice agreement model and everything would be primarily actually registered through the veterinary medical board and regulated by them. So it could be a matter of, maybe that model works, but should it be instead regulated by our program?
And there's a few concerns that Chris and I have discussed in our meetings that I think are important, and that is that, it's a little bit vague on that practice agreement. And that could be a potential positive, or it could be a negative, depending on the relationship of, the veterinarian and, some concerns about, what those fees might be, what that, because if it's just kind of left to be an agreement, then it can be very vague.
Well, I don't see how we could regulate anything that the vet is doing. It's not our jurisdiction,
can.
and I don't see how they could regulate what we're doing.
I do.
So I would think both boards need to stay in their lane and regulate each other. This is an issue that, having been in practice 31 years, we know people that decades ago, took care of animals and did a great job of taking care of animals. I hear loud and clear what the vet board's concern is with chiropractors not being qualified to deal with the emergency procedures, and that I agree with them in that regard. I also see an opportunity for there not to be such restriction with just an MSA or something of the sort with an individual practice, but if the animal has been appropriately evaluated, just like if we have a patient that comes to us that has cancer and they've seen oncologists, we don't need to have a direct relationship with that oncologist, but they've seen them, we know that it's clear to proceed with chiropractic care. I would like to see something along those lines where it's not so restrictive that they have to have an actual agreement with the vet. But that still puts a tremendous burden on the chiropractor because they have to be appropriately trained and being able to screen that individual. And I would think some collaborative effort among the vets and the chiropractors would be best, because I don't see how they could deliver what we could deliver to the animals in the same capacity. And we've seen that time and time again.
Other comments? Dr. Paris, Dr. Daniels, Jeanette?
Yeah, I would just sort of add the operationalizing a practice agreement, I think, is really going to end up very similar to what is occurring now. And, when you use the word access, that definition is very specific. And what the problem is not access, it is availability. So there's a 3-month wait list in many areas of California for a pet to see a vet for alternative care. So we just need to be clear that the access is not the issue, it's the availability. And the practice agreement is going to end up very similar to what's happening now, which many vets, which they have stated, want nothing to do with alternative care. They don't want to learn it. They want to stay in their lane. And so it puts this high burden on the vet like it is now. When you look at section A through E, the current requirements that the vet needs to maintain the records for another profession, it is a high burden regardless of kind of other views. And so many stay away from that. And so if we go to that agreement, I don't think we've changed anything. As a board, I don't think we should get in the weeds with it. We should stay in our lane. But I think it's preferred and safer if the chiropractic board regulates chiropractic. Obviously in a collaborative, as Dr. Azzolina was saying, we have patients that come to us and we work collaboratively with MDs, orthos, PTs, oncologists. So obviously there needs to be a collaborative. I mean, when you step back and look at this is not just an issue for our board and the vet board. This is an entire DCA issue because we're talking about our stakeholders, and pets now have become so significant to the human that it's beyond our board, it's beyond the vet board. So there needs to be a collaborative conversation. We need to stay in our lane. I don't think the practice agreement, I think it's going to be very messy, and unless there was very clear, lines. But those are kind of my thoughts.
Well, I'll make one other comment about the emergency. I'm less concerned about the emergency issues as I was, talking earlier about, when when a parent brings a child to a chiropractor that can't, quote, speak yet, this idea that we don't have the ability to address an emergency with something that can't communicate directly with us. Most pets aren't going to come in not walking in there in a facility on their own. They're being brought in by an owner, quote, you could refer to that as, say, a parent of that animal. And if there's been an emergency or something, most of those owners have already addressed some of those things and are now looking for other options because they didn't get satisfactory answers in the first place. That's why they're looking for an alternative. So I think a lot of those situations that we call emergencies that they're concerned about us, to date, as the presentation on Tuesday pointed out, there haven't been complaints in other states where there is access, and I believe there's 11 states that already allow direct access. And there's already DCs that are seeing animals that are collaborating with vets in the cases of emergencies and have those contacts for those situations. So the model, it's not novel. It's not like California's coming up with something new. It's being done. It's been done for a couple of decades now where these are happening, and we're not seeing a rash of animals that are being mistreated or mistreated by chiropractors in those settings. So there is a model in place. My personal feeling is that some of these objections that are brought up are more about scope issues and about business aspects rather than thinking about the animal. And that's the unfortunate thing, is that when you're thinking about this, control, you're forgetting that what we're trying to do is allow availability to owners who have pets that are suffering and in many cases are being either euthanized or mistreated and delaying treatment because they're trying to do stuff. The owners keep bringing them back because they're not getting satisfactory care, and now they're looking somewhere else. And some people are unfortunately doing that with practitioners that are truly unsafe and have no background. And that's the sad part for me, is that I think we can have collaborative, that we can, quote, stay in our lane and work together for the benefit of the animal, rather than thinking about the business side of it and who controls what, when there's already models in place that establish and create that. So that's why I feel like keeping it open, keeping it collaborative, seeing how this bill progresses, whether it does or it doesn't, it could not make it past the 24th of April, and we're right back where we started. And then the more viable option could be the whole, through sunset. And if we can come together and have some agreements that are for the benefit of our animal population, I think that would be the best all the way around.
I just have one last thing to say. I mean, I think it's been said, or at least implied. We're a distinct profession. We know our profession. We know, for our profession, what is staying in the lane. And I don't think another profession knows that better than us. It would be like asking us to regulate a veterinary licensee. Not saying I'm for it, against it, but if it just comes down to who should regulate, I feel like the chiropractic board is equipped and it's absorbable to regulate their profession.
I think they're all very valid points, both of those. I think just when they're talking about the emergency procedure, it's just a matter of, does the chiropractor know how to diagnose if there's something more? And maybe they do, maybe they don't, but if they stay in their lane, they shouldn't be crossing into that territory. But I think the bigger picture overall, which we can seize the learning opportunity here, is I think if we stress to all the other boards and we do a better job of policing our own and deal with the bad actors with a very strong hand, I think it'll send the message to others that we don't need them to step in to police our people. And I think we need to, and I say this with caution, stop being so lenient with some of these people that are on the border, which commonly they're on their border because of a technicality with legal counsel could help us with, and we can't touch them here, we can't touch them there because of free speech and whatnot. But we know if they're bad actors, I think we have to go after them. And I think if we do that, and we do that effectively, and we do that collaboratively with the other boards, I think we'll give them some assurance that this is not going to just, giving direct access or allowing animals to, pet owners to bring their animals in is not just going to be this rampant, new thing that we're going to see all these people advertising on Facebook or Instagram and, dealing with a lot of the things that we've dealt with human beings. The sad part is these people can bring their animal into a massage therapist for direct access, and they do things, and nobody's regulating that whatsoever. So I think we can give them some assurance that we're going to be watching closely on this, and we'll look at any complaints, and we'll stay in touch with other states and see how it's working out.
Does this give you enough?
That gives me a lot. Yeah, that's exactly, that's what I was kind of looking for.
Overachievers.
Well,
Yeah.
letting it settle.
Yeah.
I just have a comment and then a question. One regarding the issue of oversight and veterinary to chiropractic relationship, and I agree with Dr. Daniels that gets more muddy than less muddy, I think, as it was presented with some contract, and I can think of so many things that can go wrong there, more than right, maybe. But I'm wondering, when I take my dogs simply to get groomed, I have to always present a certificate showing that they've received shots, that they're current. And I don't know what the time frame is on that, but so I'm wondering if there isn't some way to think of this as you don't necessarily have to establish a relationship with the veterinarian, you just have to know that that animal patient has seen a veterinarian, that they've had some sort of visit or physical exam in whatever time frame, and obviously not just and I don't want to conflate with what I just said about getting their shots, because there's really no exam done there that I'm aware of. We usually have it done at the same place we get them groomed. Somebody comes in, but it's usually a veterinarian that sets up shop and does it. So I don't know if they're coding and billing for an exam, but
Their board bill was passed. Actually, I think they were against it, but I think Newsom passed it, where that veterinary relationship is established by the vet tech. So there is actually no, in many cases, not all, when they're doing hundreds of vaccines a day, there is no licensed vet that is overseeing it, because it is now okay, or it's been regulated, that the vet tech can establish that, I forget what they call it, that client patient relationship.
Okay.
So there is there's no way a licensee can oversee 200 animals in a visit, establish a relationship with each one. So a bill was passed several years ago that now allows the vet techs to establish that relationship.
Okay. So I guess the further question would be then, is that sufficient? And we would, maybe not our concern, but more importantly, are they actually doing some sort of evaluation that would give assurances that that animal patient
Well, I believe, and Kristen can correct me if I'm wrong, I believe in the bill, in both bills and in the current bill, there's a question as to have they seen a vet within the last 12 months, and that's exactly why when you first read the question, you're like, okay, what's that telling you? But that's exactly why that question is in there, is to confirm that that animal has been seen by a vet.
Right.
Yeah.
And does that include all the extenders, as you were just saying? So
It's
the
very,
vet tech or whoever else?
it's a very plain language. Again, it's not for me to get in the weeds with their bill, but they've
Yeah,
kept it very
right.
plain, which,
So-
is an issue, but that's for them to navigate.
So maybe there's a solution there where we don't have to get in the weeds of, because as was mentioned, Rule patient care is difficult, and I would imagine rural veterinary care is even more difficult, especially as you get into specialties. And I think it's just a reflection of what we see with
Medical.
caring for humans. It gets more difficult as we get further away. There's lots of reasons. So I'm wondering if maybe that isn't a reasonable solution, just to have assurances that animal patient has established care with the veterinarian and has done it in X amount of time frame leading up to the chiropractic visit.
So just to reframe, you would be, in favor of them putting something like that in there in order for us to regulate the...
Well, I didn't say I was in favor of my own thoughts, but they did come out of my head, so I know that. But I was simply trying to work through that, seemingly what was the discussion, the problem presented as a reasonable solution. But I do think it's a reasonable solution, and in this moment, the way I reiterated it, I think that's a fair and reasonable way to have assurances that they have. And also, I think it reflects a little bit back on the ability to have somewhere to take this animal should there be an emergency. Is not all emergent conditions require an animal hospital open 24 hours, right? I mean, it could be something where they're like, well, I'll have to take them to see my vet on Monday, or, so I think we always think of like emergency, like there's a heart attack going on, right? And that's maybe not necessarily true. There's emergent conditions that maybe, are not as acute as others. So I think that also gives assurances that veterinary, that animal patient and their owner have somewhere to go back because they've established a relationship. And so I think it ties into both. And I do think it's reasonable, yeah. I just don't know how I'd vote on it if I had to, right? But, yeah.
Is that
Yeah.
clear, Kristen?
And then
It's helpful. Yeah.
Kristen.
Okay.
And then my
Okay.
question was, I'm sorry, I have one more thing. My question was regarding the hours. I know there were some proposed components of that education program, and and some suggestions as to what might be included in that, and that potentially had the ability to bump up the hours to maybe necessarily include those. I don't remember it being as granular as like saying this many hours for this many things, but there's some competencies and some objectives and certain. And I'm wondering if there's been any further discussion or delineation around that, like in the ability to maybe consider increased hours.
I know that they are, I don't know where their current status is. I know they're working on trying to get it to 300 hours with a more competency-based lens.
Yeah.
I don't know where they're at in that process. So
I think in Marissa's presentation on Tuesday, I think I heard her say that the hours are at about 240 right now.
they're 240 right now, but they're looking to try and get
Right.
it up to like, our functional neuro.
Like a diplomate level.
Yep.
Exactly.
General,
They're working
yeah.
on it. They realize that would be, a higher
Yes.
level,
Yeah.
but they're at 240 right now.
Okay, great.
I think if the animals could speak, they'd want to have access. Because it seems like every other profession is going to greater and greater and greater access. And you remember the teeth whitening case with the dental board. This could be
Yeah.
another one of those cases. My prediction is before we even get through this, private equity that's swapping up all the vet places is going to start putting chiropractors in there.
We know that when we ask the human population, our patients, if they want access, it's always overwhelmingly yes, whether that's in private healthcare systems or in insurance coverage plans. So I agree with you. Our animals would agree.
All right.
Good.
Ms. Cruz, anything
I guess.
you want to add?
No, what's it called? I was in a lot of the conversations you were in with, what's it called, in our prior committee kind of meetings. So, no, I think it definitely covers it.
Kristen, real quick, how much more do you think you have on your report? I've had a request for a bio break.
I have one more item, and it's
So
actually
about-
really quick.
About 2-3 minutes?
I can make it 2 or 3.
Okay,
yeah.
great.
So the final real action item coming out of Sunset Review, and it was the one we talked about earlier, had to do with licensee population size trends. The problem is over the past 15 years, the number of DCs has been decreasing. increasing in California. We evaluated those numbers, and what it's kind of equating to about a net loss of about 165 active licensees every year. So not significant, but once you start making that a decade, 15 years, 20, it starts to count. The response to this issue is more framed forward-looking. So my recommendation is that the board consider as part of the strategic plan discussions that we're going to have later today, doing a formal study on the issue. Let's get perspectives from licensees. Let's get a lot of data. There's a lot of different contributing factors to what's going on, but rather than trying to just jam them all into one response, instead let's take that 4-year period to really study the issue, put some different perspectives, and then see if any of those result in any kind of policy recommendations that we may have that we'd want to integrate into our next sunset review report to the legislature. So that's kind of my recommendation for an approach there. And again, also something I recommend we discuss further this afternoon as far as just formalizing that into the plan itself. Fast enough? Hopefully, that was a minute.
That's great. Well, if you needed another minute,
No, that was it.
I don't
No,
think we,
I
I don't
don't
think
think
we
we-
don't, I don't think anyone's,
Yeah.
gonna miss 1 minute there, but,
Yeah.
Speak for yourself.
okay. I am speaking for myself, I guess. So that's the conclusion of your report. Was
Yes.
there any other questions or comments?
I would agree. I think that's a great topic for
Yep.
the committee this afternoon.
So I will take this, finalize the final draft, and then we'll do a vote in the morning on that language. But beyond that, I don't need anything further from the board on this discussion item. And we can definitely take a break.
We'll revisit
Excellent.
item 9 in the morning.
Correct. All right, we will take, what was everybody, we got to take about, is there a mandatory time, like 10? Or is it 5 or what?
Isn't it 15?
Should we do 10?
It's 15 for staff, but they're not being held here, so they're frequent. They're
Are you guys all
being-
okay
Tie
with 10?
down.
Because I want to make sure we get through everything and not push
Let's
ourselves
10
in the
is
back.
fine.
Let's do
10 so we can at least
Okay,
get the lunch
perfect.
first.
We're on a 10-minute break. Everybody enjoy a 10-minute break.
Get your wrinkles out.
And we are back. All right. We are on agenda item 10. As we're tabling 9, so there's nothing to vote on. Was there any public comment before we move to agenda item 10? No public members present, so we'll move to agenda item 10. And Ms. Walker, if you can give us a overview as succinctly and as quickly as you can of legislative bills, that would be wonderful.
Happy to do so.
Thank you.
So we've got a handful of bills here in the meeting materials. I will say a lot of the bills are either spot bills or they're not of great significance to the board, but it's more information only. Starting with AB 1558, it's the Uniform Emergency Volunteer Practitioners Act. What this bill does, just at a very high level summary, is it kind of expands the existing Emergency Medical Services Authority program that enables like out-of-state licensees to come in and assist during an emergency. And then it also is going to grant authority to the boards to have additional enforcement mechanisms in that area. This really doesn't affect chiropractic all that much. We saw a little bit of this during the pandemic when they were bringing in reinforcements for healthcare needs. There were some DCs that came in from out of state. We didn't receive a single complaint about them. We got the notification they were here and serving that purpose, and it was kind of inconsequential for our board. It's more common for more in the nursing profession when they need to ramp up quickly. So this is really just an informational only bill. It's scheduled to be heard on Tuesday before committee, but no ask there, just information. The next bill is AB 1671. This bill would basically establish a grant program for the delivery of care, medical services to individuals in rural areas. It would authorize up to $10,000 grants with a $3 million cap. Again, informational only, just bringing it to the board's attention that there is this grant program being considered. We will see if this one proceeds anywhere. We've got AB 1767, again, informational only. This is a Berman bill relating to conflicts of interest as it affects public members of DCA boards. This bill simply just defines what close family member means for purposes of that conflict of interest. So again, just FYI. We've got AB 1775 relating to veterans. This one does affect the board. This is a bill that would require DCA boards to expedite and authorize them to assist the licensure process for an applicant who's received a discharge solely as the result of the executive order that prohibits transgender individuals from serving in the military. So we've got the existing framework for expediting honorably discharged veterans, military spouses. This just expands that one little layer further. We have no estimated fiscal impact on our board for two reasons. One, the framework already exists, so we would just be opening it up to an additional population. And also, based on our estimations and what we see with the existing process, we may receive up to one, if any, every year. So that bill is going to affect us. It likely will have to make a little bit of changes potentially to some regulatory language, but beyond that, it's not going to have a real operational impact on the board. We've got AB 1979 around healthcare services relating to artificial intelligence. So this bill was actually recently amended and narrowed. As it was initially introduced, it would have been problematic because it was too broad. But now what this bill would do would prohibit a health facility, clinic, physician's office, or office or group practice from using or deploying a tool, system, or device that includes AI to replace the use of professional judgment by a licensed healthcare professional, and then prohibit the use of AI to direct, guide, supervise, or instruct unlicensed personnel in performing any function that requires a professional license. The previous version of the bill would have prohibited the use of AI for any function that requires professional judgment, which is different. Now they've narrowed it down to just you cannot use AI to replace your professional judgment. This bill has been referred to Assembly Privacy and Consumer Protection Committee. The board may wish to discuss that one a little bit after I rattle through my summaries here. You've got AB 2140. This is a spot bill. As it stands right now, it relates to the reporting of settlements, judgments, and arbitration awards against licensees to DCA Healing Arts Boards. As introduced as a spot bill, it would just increase the minimum fine amount from $50 to $100. That's likely not going to be the final version of the bill, and as introduced, it has absolutely no impact on us because our minimum fine amount anyways is $100. So we will continue to watch that. We've also got AB 2546, which is a spot bill related to DCA. At this point, there's nothing substantive in that bill, but we'll continue to monitor. You've got AB 2551 relating to healthcare coverage. This bill would require the DCA Healing Arts Workforce Survey at the renewal process to be expanded to ask whether a licensee is a contracted provider and the types of healthcare coverage under which those contracted services are provided. We have an estimated fiscal impact of nothing for this bill because the larger effort of integrating that information into the renewal form would be handled by DCA and the Healthcare Access and HCI office. So no direct impact on us. They would kind of take care of it behind the scenes if it was to pass, and it would be automatically implemented. AB 2775 is the board's sunset bill. I will be asking the board to consider a support position for the sunset bill. As it's currently introduced, it just simply declares the intent of the legislature to evaluate the board, also requiring the board to distribute a copy of the directory electronically to each licensee, and then distribute the copy by mail if requested, but prohibit the board from charging for that. Again, it's introduced as a spot bill. It will be amended later, but I am going to be requesting that the board simply go on the record in support of its own bill, and then we will have to have a later discussion, likely in May or early June, once those amendments are in place for the board to take a position with the amendments that we've requested and
As it
Move those
pertains
down.
to our asks in the
Exactly.
bill. Okay.
Yeah, but for now, the request is just go on the record in support of the sunset process in our bill as it stands today. We've also got SB 980, which relates to access to medical records. The bill prohibits a healthcare provider from charging a fee to a patient for completing health-related forms that are required by an educational institution or child care provider for participation in school, child care or school-sponsored activities. We're watching that bill.
And then we have, finally, we've got SB 1269, the Ochoa Vogue bill relating to animal chiropractic practitioners. This bill is very similar to what we saw last year with SB 687, with the exception that it also, in addition to the animal chiropractic practitioner, it would require that animal chiropractic premises be registered with the board. It also implements a new cap for the amount of time to allow for direct access. I believe it's 3 months or up to 8 visits.
Whichever comes first, I think.
Yeah, whichever one comes first. This one does have a relatively minor fiscal impact on the board. We're anticipating about $100,000 in IT costs. That breaks down to basically $50,000 per license type for the new registrations, and then the new ongoing costs is about $20,000. That's based on our estimation that we reviewed the AVCA and IVCA websites. We identified just 41 California licensees that are currently certified through one or both of those entities. So that's your initial kind of licensee population. And then looking at data on animal chiropractic in general, we're estimating, potentially up to 300 individuals would pursue this in the near term. So this is a bill the board may want to discuss, but we've also discussed animal chiropractic earlier during today's meeting, so you may or may not want a discussion there. And then the final bill, SB 1391, is a WAHB bill. That's a spot bill relating to retired licenses. So, like I said, a lot of updates there when it comes to regulation. The board may want to talk about the AI bill. The board may want to consider a position on our sunset bill. But beyond that, just a lot of updates for you this morning.
Excellent. Comments or questions from the,
Kristen, do you want a formal vote on AB 2775 for support, or just a casual?
It'd be a request for a motion.
Okay.
Yeah.
All right.
I have a question on J, SB 980.
Okay.
Does this imply that a chiropractor doing, say, sports physicals or return to play from concussion, evaluations, et cetera, would be, in effect, compelled to complete that health form if it was for the school? Or pre-participation physical, because that goes back to the school, right?
Fee.
So would that be a health-related form? So that would be a school-sponsored activity. So I think we might want to maybe consider more than watch that, if that's the case.
I would agree.
I think we might formulate a stronger opinion on that.
I would think sports
As it
physicals,
stands,
anything, yeah.
we'd be asking DCs and other providers, I guess, right, to work for free.
Look at the language.
Because it's
The
saying,
Is it about
language
a
is
form?
filling out a form. It
Yeah,
doesn't say.
it's about a fee.
Providing service.
Yeah.
It's not
Right.
about providing service
But a
or doing an exam.
How do you fill out what form do you fill out where you're not
So-
making a clinical decision,
And these forms
It's
can be
about public
burdensome. also.
benefits.
What's
About a
that?
public benefit program. So, if you look at the today's law is amended, it actually defines what programs, is subsection subsection A of the bill. It says a healthcare provider shall not charge a fee to a patient for filling out forms or providing information responsive to forms that support a claim or appeal regarding eligibility for a public benefit program, or for completing the health-related forms required by educational, and the rest of that language. And then they do talk about, so it's about the fee, like they can't collect a fee for it.
For a form.
For the
filling
form,
out the
though.
form.
Not the visit, though, just
Right.
the form.
It's for, it sounds like filling out a form.
Oh,
And then
okay.
and then
Oh, I
in
gotcha.
subsection D, it talks about what public benefit
Seems like
programs
semantics.
are, which ones fall under that. If a healthcare provider conducts an examination pursuant to the form or whatever.
But what is the rest of that? If a healthcare provider conducts an examination?
Pursuant to subsection B, the healthcare provider shall provide information responsive to those portions of the form for which the healthcare provider has a medical opinion. So subsection B, which C was referring to, is a healthcare provider shall provide information responsive to those portions of the form for which the healthcare provider has the information necessary to provide a medical opinion. If If the healthcare provider does not have the information necessary to provide a medical opinion, the healthcare provider may inform the patient if an examination is necessary to obtain the information.
And thus, you now can
Can charge.
It says shall not charge a fee to fill out the forms. But this is about filling out the forms. I don't think it has anything to do with the examination.
But a form actually is not a 5-minute fill-out job. I mean, the signature is, but many of these forms need exam findings transcribed and whatnot.
There's no bill analysis yet. Also, looks like.
Well, I'm thinking of, yeah.
Sabina, what is the
I mean, that's a
point
great comment, you know,
of this?
concussion
Like, are there
protocol
situations
or-
where
or-
people are just charging
or,
a fee just
you
to
know,
fill out a
clearing a
form
child
without
to-
doing an
to
exam?
Participate.
Do you know?
the pre-participation.
Would
Do
you
you
have to
know?
evaluate?
No, we don't have a lot of background yet on this one.
Yeah, like I said, there's no analysis yet.
Yeah.
So it says the bill would, in part of like the introduction in the alleged counsel's digest, it said it would prohibit a healthcare provider from charging a fee to a patient for completing health-related forms required by education, health, child care, or participation in school, child care, or school-sponsored activities.
Medicare, Social Security.
That's very vague.
I would include
Expanding
athletics,
the
I would
requirements on
assume.
healthcare providers and thereby expanding a crime. But it's just about seems like just about a fee surrounding that form. And then there's no other information, there's no analysis yet either.
Can we reach out to the author?
The hearing is set for the 22nd.
That just seems very vague to me about what, you know, I mean, if it's semantics, it's like, well, I'm charging for an exam, but I'm not charging for filling out the form. That just seems,
There must have been some kind of
Nonsense.
something happening.
Something naughty.
Yeah. I
On
think
their end,
maybe
or
they were hitting.
who's doing the naughty things here?
Maybe
I'm
they were
trying to figure
hitting him
this out.
twice.
Yeah,
For the
for the
examination
form,
and the
yeah.
form.
That's
Maybe
what it
they're,
sounds like.
I mean,
Gotcha.
now they're eliminating the form fee.
Well, but being on the other end here, I mean, we get inundated with parents thinking, oh, you just need to fill this out, and they're hesitant to go through an examination. They say, we can't write things down on a form without evaluating
yeah, I
an
mean, if
individual.
you're rendering an opinion that a child is, say, cleared for concussion after a concussion protocol, or if something's coming to you to say, can I participate in sports? And we're not, I do an exam. I'm gonna do an exam on their physical capability.
We have to.
Have to.
Legally.
So,
Can we reach out to the author for clarification on?
Yeah, we definitely.
and often the form will kind of lead you in the direction, because they're gonna ask specific questions about, can they do this, can they do that, can they do this, can they do that, relative to the sport they're participating in.
If we could just get a little more clarity from the
Yeah.
author and what the intent was, and what is the genesis of this?
Definitely. Yeah, so like I said, it's, or like Sabina said, it's scheduled for a hearing next week. I would say let's
Wait
see
for
if
that,
it,
yeah.
let's see if it makes it, and if it moves, then
Yeah.
we'll certainly follow back up
Yeah.
with all
Yeah.
that additional
Sounds
information,
good.
and we'll put it on that agenda when we talk about our sunset bill.
Because
We'll get
after that, they will also have an analysis.
Yeah.
Okay.
Yeah.
Sounds good.
Kind of for all of these, right?
Yeah.
Like we gotta wait and see if they move.
Yeah.
I was saying kind of for all of these, we gotta kind of wait and see if
Yeah.
they move. Okay.
Yeah.
Okay, I have no other
We'll
questions.
watch them
Thank you.
all. You don't have to take a special position to watch something. We'll be monitoring them
Yeah,
all.
thank you.
So, if there's no other comments about any other bills, I would like to entertain a motion relative to the ask on the part of the staff for the sunset bill, specifically a motion on AB 2775, State Board of Examiners bill. Do we have specific language that you want us, or just that we are in support of the bill?
I'll just make a motion that we're in support of AB 2775.
I'll second that. Is there any public comment? Hearing none. Jeanette, would you please call the roll, Ms. Cruz?
Yep.
Thank you.
Dr. Adams?
Yes.
Dr. Daniels?
Yes.
Ms. Cruz, yes. Dr. Azalino?
Yes.
Dr. Paris?
Yes.
Motion carries. Okay. Agenda item 11, National Board of Chiropractic Examiners and Federation of Chiropractic Licensing Boards update. Ms. Walker.
So this agenda item is based on the NBCE FCLB proposed merger into a single organization. They've put out a little bit of messaging on it. They've also now shared the proposed amendments to the NBCE bylaws and then the updates to the FCLB bylaws. In summary, what they're basically looking to do is to consolidate the two corporate entities into one surviving entity, which would be the NBCE, and then to make the FCLB a committee as part of that new corporate structure. We evaluated this kind of proposed structure here, and it's one of those issues that my recommendation on it is that it's not quite within the board's lane to really weigh in on it or not. It's an issue that's involving, you know, the corporate entities and their structure and their business decisions that they're going to do. The board's role is more on the regulatory side, and obviously we receive services from both entities. You know, we participate in a number of the FCLB services and events, and we utilize you know, things like their SINBAD reporting mechanisms. Then on the NBCE side, we rely on their examinations, and then we do our appropriate oversight over both, and you know, kind of vote with our feet in continuing to get those services. But the request out of NBCE and FCLB is to have delegates and representatives formally cast a vote on those proposed changes at the annual conference and the annual business meeting. Recommendation that I have, and I believe Ms. Knight agrees with me, is that the board should consider just taking no position and abstaining on the matter and letting it kind of take its course. It's not quite something that for the regulatory boards to kind of decide.
Good counsel. Let's have a discussion if there is any comments on it. Otherwise, I'll entertain a motion. I think our delegate for the, do we need to do the delegate because of the situation that we're?
Yeah, so.
I think we need to address the delegate because I think Ms. Cruz, you're
I recuse myself.
unable to attend now, so she was our delegate.
Mhm.
So.
Well, so we could take it in either order. We need the board to make a decision on this position on this NBCE FCLB bylaw change. And then the broader issue is we currently don't have a representative that we can use for the conference in Atlanta. So the broader recommendation is that the board consider nominating David Paris to be the board's representative to cast any of the votes and represent the board at that meeting. But the board itself needs to take a position on that merger, and then Dr. Paris can.
And I have
accordingly.
spoken to Dr. Yeager, Jason. Is it Jagger or Yeager? I think it's Yeager. And he says that, and I think you're going to be in attendance, so you could actually be that representative because you don't have to be a chiropractor to
For
represent for FCLB vote.
Is going?
You're going. Yeah.
So our two options could be we empower Dr. Paris to vote the way the board wants to vote for that particular part, and then he obviously has his discretion as the District 4 director for FCLB, and he could separate those. He can represent the board and represent his position as well. Or my opinion might be cleaner is have you represent the board and have Dr. Paris represent his position rather than,
Yeah.
Yeah, I agree.
you know.
Optics.
So,
Yeah.
yeah, probably the preferred, and I will abstain from this vote today, but probably because to be the NBCE delegate, you have to be a licensee.
Correct.
So we would make that motion, probably me, and then Ms. Walker would be our FCLB
Correct.
delegate.
Correct.
I think, yeah, okay, yeah. And I'm happy that we're having representation. I'm sorry you can't make it. think he would have loved it.
So we essentially have to do two motions,
Is it?
correct?
Correct, so we need one on position, whether we'll abstain or take a position on the merger, and then who will be carrying that vote at the.
So is there any discussion on the first principle, and that is relative what our position? Do we want to take staff recommendation that we, as a regulatory board and as a licensing board, take a position of abstain? And then,
I'm in favor of that.
and then, you know, is there just a discussion on that? If there's no discussion, I'm going to assume that we're in support of what the staff recommendation is, and I'll entertain a motion on that particular issue.
Do I have to, is there a specific language or just?
You would move to, for the board to abstain on casting a vote concerning the position of the merger of NBCE and FCLB. You can say so moved.
I was like,
The combining of the boards.
Yeah.
Just say so moved.
so moved.
On the
Yes,
merger,
thank you.
yeah.
A second?
I'll second.
Okay, is everybody clear on what the first motion is?
Yes.
So it's to
Okay.
abstain
Just the
on the
merger.
vote on the merger of the two
Right.
entities.
Right.
As a board,
And
as
then
an
their second
entity,
vote will be who we're empowering to do that.
at the
Okay.
annual meeting in Atlanta at the end of this month / beginning of May.
We have a second,
I already
Wait
seconded.
a
Right.
second.
and
Public comment?
so public comment on this particular motion. Hearing none, we'll go to the vote.
All right. Dr. Adams?
Yes.
Dr. Daniels?
Yes.
Ms. Cruz, yes. Dr. Azzalino?
Yes.
Dr. Paris?
Abstain.
Motion carries.
Motion carries.
So then you just have to have a motion about who will replace Ms. Cruz as delegate to then cast. the-
So moved.
Or,
Do you have?
I didn't say anybody
Yeah.
yet.
Well, I
Do you
can
know the
it.
lang- okay,
I
so
mean,
Dr.
yeah,
Daniels
I
will
would just
do it.
make
Yeah,
a
go ahead.
motion to nominate Dr. Paris to be our NBCE representative, and that we nominate Ms. Kristen Walker to be our FCLB representative at the upcoming meeting in Atlanta.
I'll second that.
Alrighty. Vote?
Any,
Oh, public comment.
any public comment on the second motion on the table? Hearing none, Ms. Cruz?
All right. Dr. Adams?
Yes.
Dr. Daniels?
Yes.
Ms. Cruz, yes. Dr. Azzalino?
Yes.
Dr. Paris?
Abstain.
So moved.
Motion carries.
Motion carries.
Okay, did we complete everything related to item 11,
Mhm.
Ms. Walker? Okay, Ms. Sabina? Okay, great. We'll now go to the continuing education update to the board, March 5th.
Are you punting?
Does that fall to me?
Yeah, you're the
You're the
Oh,
chair.
I am the chair? I forgot I was chair. I thought you were the chair.
Put it in your notes.
I have two other things I'm doing.
What's that?
I said I put it in your notes to deliver your update.
Oh.
Oh.
I didn't see that on here.
I think he's punting to you.
I don't think it says that in here. So, we had a continuing education meeting on March 5th, and it was very short and sweet. It was great, and we discussed fees relative to to PACE and what we're dealing with, and it was the feeling that we felt that. And based on, staff discussions about the pending fee review, that it was in the best interest of, the board to continue to deal with continuing education and not turn that over completely to PACE. That we like the language that's there, that PACE providers obviously can do that, but also that courses and things will still be reviewed by that. And with the reductions in fees that may be coming as it relates to the efficiencies that we're going to create through Connect, that we feel that will take care of that question, and because the fees going down and being more appropriately commensurate with the work responsibility on the part of staff will bring more continuing education and courses back into the state, and we'll be able to handle those more appropriately and more efficiently.
But we also had a broader solution, which, Ms. Walker, can you remember we talked about kind of changing the how we're handling CE and the potential inclusion of PACE?
We had a few ideas at a broader level too when it came to the way we would accept continuing education. One of them was under the current system, we currently accept all healing arts boards continuing education for credit. The committee engaged in a bit of a discussion of really evaluating which boards those are and then making sure that they align with doctoral level kind of education, or that they're substantially equivalent to kind of the rigor of chiropractic education, so that we narrow that list down, because theoretically you have language like a veterinary technician or other types of technician level providers would qualify for current board CE. Instead, maybe take a look and get more to that primary direct access type provider level. So we're going to work on that. And then looking broader at continuing education, we did have a pretty good discussion around just looking at the workload that's involved with evaluating the courses and what does the potential future of that look like. Under the new regulations, we're working towards obviously implementing those 4 new competency areas that are mandatory, and trying to figure out a system to where when we're doing that review process, we can integrate either board members or our continuing education committee to really evaluate the course from that perspective, so that it's not just a staff review of the course, and then look at broader, like how are we going to handle electives, and are we going to continue to evaluate electives at that same level of scrutiny that we currently do, or do we pull back a bit and focus more on the mandatory? So there was a lot of good discussion there on those points.
Excellent. And then also moving away from an idea that we had dealt with before about biannual renewals, and because of our fiscal situation, moving more to an annual basis, so that way we always have a picture of where we are each year. For example, we had talked about, a course gets approved and then it's approved for 3 years. So you get this big influx of continuing education, and then there's a dearth for 3 years. And so that's not allowing us to give a good relationship to our fiscal responsibility. So moving that to, more, the fees to be associated with more annual rather than biannual or 3-4 years, that type of thing. So. Anyway, and I think it'll be clear when tomorrow we deal with number 9 again, and we have more specific numbers based on the internal fee evaluation that's been done at the BCE by Kristen and staff. That's my report. Any public comment?
Can I have a comment?
Absolutely.
Just in discussion.
Sure. Sorry.
So I have concerns about the limitation of access, that us not utilizing PACE, it seems to severely limit our licensees in attending high quality education that's done outside of California on the national level. And that includes opportunities provided by our largest national association, American Chiropractic Association. That includes scientific conferences. That includes the largest conferences that bring in prominent healthcare speakers and progressive concepts and ideas for chiropractors that you only see at events like that. Like I'll just use Parker as like an example. And they've severely limited over the last few years, to only a handful of CE opportunities there. And so I have significant concerns about the rationale behind not allowing our providers to take advantage and opportunity of. If you look at the diplomate boards, we were talking about the ABCA and them increasing hours and maybe potentially having CE, and well, those large conferences and opportunities for diplomate board specialty certifications, et cetera, those generally happen outside of the state. They come to California once every 4 or 5 years or something. And so we're severely limiting our licensees, ability to maintain certification and competency in those specialties, along with all the other things. Because those programs, especially the smaller ones like the individual specialty boards, generally are running on an even smaller budget, and almost all of them do PACE. And I will also add that as chiropractic grows into the integrated healthcare systems, and I'll use VA as an example. There are many, though. Groups will provide for CE, but they are only doing PACE. So all of the DCs that work at the VA systems in California that are California licensed, none of them get CE, and we have so many opportunities, and they're all PACE approved. And so I have significant concerns there, and I'm wondering how what I still don't understand. I understand that there's a fiscal opportunity for us, but I don't think we should be putting that in front of access. And I don't think our fiscal opportunities or lack of them provide as much public protection as, you know, what I just mentioned, the ability to give our licensees access to kind of, you know, bigger, larger, more robust CE opportunities. Thank you.
Okay, any other comments, questions there? I'm curious, when you say in the last few years, was the fee increase a determinant factor of why some of those PACE dropped out of covering? Because that's the feedback that we're getting when we hear from, like, even on Tuesday we heard from other entities that aren't involved in California more because of the high fees. And I wonder, before the fees went up, was that an issue?
Well, I mean, I think it's always an issue on a smaller level, because there's groups who simply can't. If you're doing an event with a smaller, like a certification group, or maybe another state, even some that are connected to us physically, where they do a lot. The California Chiropractic Association used to do their event in Nevada, right? So states, we travel to do the CE. So I think if they're smaller groups, then they simply can't reach out to all the states. And so, the model of having one certification as an opportunity for them to do outreach to, all the providers. I definitely, I mean, our fee increase was, fairly significant, and we heard a lot of feedback from our stakeholders. But I don't know that was the only reason, so I don't want to impress that, that's,
I just don't remember hearing about the access issue prior to that fee issue.
Yeah, well.
When it was $56, you didn't hear anything.
Well,
when it went to $116 an hour, that changed things drastically.
Yeah. So I mean, the fees, definitely probably influence, especially the larger groups,
Right.
for sure.
Right.
Kristen, during our meeting, didn't we have more of a solution for PACE, either including it as electives? We had a kind of a broader solution that seemed to be workable that I'm not sure you mentioned.
We did discuss that a bit, as was the potential for could PACE plug in the electives, since it's like
Right.
we've got that was part of the discussion too, because we were looking at the states, and would you open the door to PACE for the electives, and then the other thing that we talked about was the need for us to broaden up the language a bit, because there's PACE now, but what is future PACE, and what would that criteria be for the board to consider, allowing that as well? Like if another entity wanted to create their own version of PACE, and we do have in the public comment materials, which I meant to mention earlier, we received a public comment about CE and the rigor of the courses, and it was alluding to the fact of wanting to almost have an additional plug-in. You've got PACE doing the vetting, you've got the boards doing the vetting, but having an additional entity that's involved in vetting those courses.
Well, for the operational side of it,
so
for the attendance and that sort of thing, not content.
Correct.
Yeah.
So we did talk about it broadly. I guess we would just need to figure out how that fits, that we're not, it's not solely going with PACE, but broader, so that it could plan for the future as well. That was part of the discussion.
So my recollection, we were kind of landing on allowing PACE for the electives, because I know that some of the committees, even though we're not doing it now, we're trying to move more to competency, different avenues for competency for CE. So PACE would need to kind of fall in line with that. But we ended, I thought, the conversation with being open to having PACE for the electives. And then while we're
Yeah.
writing broader regulations for CE and really tailoring it to more competency, not just butts in the seats, and then other avenues for that.
And I think that aligns with, you know, when I came on the board in 2018, we were discussing this, and one of the ideas behind like looking at competencies, and we've gone through, you know, a couple twists and turns,
Yeah.
and I'm happy where we're at having this discussion. But the idea even back then was, you know, looking at what really matters as far as like mandated CE versus electives, and fully supportive of that. And so I think that aligns with kind of our initial intent, which was to have staff and you know, the BCE doing very, very, very thorough, you know, overview and checks and oversight of the mandated CE, because those are the things that we developed here in this board, you know, that were meaningful.
And that's what
subject
kind
matter.
of Kristen was alluding to, that, you know, in our committee, we were talking about really moving towards more of a platform where, you know, the licensees on the board are playing a more active role in auditing,
vetting
but
and auditing.
really focused on the mandatory.
Yeah, exactly. So thank you for that. So
Yeah.
I feel more comfortable knowing that we still provide the opportunity for our licensees to attend those events and get
Right.
some sort
Yeah.
of, you know, CE credit.
We also were thinking along the same lines, though, that if that fee came down, then it would take care of itself, because it's not going to exclude, and it still gives some oversight, and then the question can become, you know, how much oversight, and I think that's, you know, one of the other. We already have in the new CE package, PACE providers are already approved. That's the one that's already working its way through. But we had retained, in part because of you and I having attended meetings in the past where we weren't assured that there was that, and now
Right.
we've seen that there's better, so
Yeah.
better, you know, of that auditing, if you will. Yeah.
Yeah, and I think they've done, you know, I think we brought, maybe not the first, but we definitely brought that issue from
Mhm.
California to their attention
Right.
through attending those meetings, and I think they've done a really good job. They've attended our meetings as guests and presented to us on the efforts to have the checks and balances with the CE there. Okay, well, I feel better knowing that there's something that's coming back to, I guess
Yeah.
this will come back to the board with, at some point.
Yeah.
I feel better knowing that we still provide opportunity that way, you know, and I do agree that was the original intent, so I'm glad that hasn't really shifted where our
Well, that
focus is
CE
on the
package,
mandated.
that CE package is not finalized yet, and there's some things that, you know, with these changes that we're gonna make, you know, through sunset, if we're allowed to do those and get those fees to be put in place, that's gonna, in a sense, change that access, because that would be an immediate fee change, that it's gonna, would change that. And then as the regulatory package goes through, we can also continue to fine tune that as well, because some of those things are already gonna have to change because of some of the things that we're changing.
Right, yeah, I think that'll help too.
Yeah.
I think, yeah.
Absolutely.
Okay, great, thank you. Thanks for hearing me.
Anything else?
So, you were the comment on that, so we'll go to public comment, and there's none, so there's no motion. So we'll go to agenda item 13 for the Enforcement Committee report. I know that Mr. Sweet is not here, so are you doing that for him?
Yes,
Great. I'll turn the time to you.
Okay. Sure. So the Enforcement Committee met via WebEx on March 18th, and they discussed two policy issues. They were provided quite a bit of input to staff when it comes to our development of that minimum supervision and training requirements for chiropractic assistants, responsibility for conduct on the premises, and sexual misconduct regulation that we're working on. Particularly around, the discussion really centered around the need for us to develop strong language that puts the responsibility on the licensee, so they understand what their obligations are, but then also ensuring that it's enforceable, rather than being so granular necessarily on the chiropractic assistant itself. That was kind of, a lot of the discussion was around that. We also started evaluating some of the proposed definitions for terms like supervision, direct on-site supervision, and general supervision, so that we could kind of craft this regulation. And then there was also a little bit of discussion around the recent changes made to Medicare and Medicaid services around direct supervision of services that are incident to a physician's professional services. And basically, with their removal, the requirement that that direct supervision require the physical presence of a physician, and instead opens the door for more virtual presence and audio video kind of remote monitoring. So kind of those implications there. Where we go next is staff is certainly taken all of that input. We're planning to craft some final language that ideally we can get before the enforcement committee in early summer, and ideally hopefully bring something to the full board for our July meeting. They also, we also have a recommendation coming out of the enforcement committee. I'm not requesting a formal motion from the board. I'm mostly just because we would incorporate this into the language that we would bring forward to the board, but I'm more looking for either consensus or input one way or another on that recommendation. And it relates to the, what we refer to as the trigger language that we use for the uniform standards for substance abusing licensees. While those standards are required for all the DCA programs, the boards do have discretion on determining which trigger they're going to implement for when those uniform standards apply. There's 3 of them. The first would be establishing a presumption that they're a substance abusing licensee if the underlying conduct involves drugs or alcohol, and then kind of putting the onus on the licensee to rebut that presumption unless or otherwise the uniform standards would apply. There's the middle ground where you require a clinical diagnostic evaluation of the licensee in all circumstances, and then based on the outcome of that evaluation, you then apply them or not. That one is kind of in the middle. And then there was the third option, which would require the board to establish evidence that the licensee is a substance abusing licensee after providing notice and conducting a hearing. So I had presented a recommendation to the enforcement committee when the board really last formally evaluated the issue in 2014. The board was voted to move forward with the third option, which would require the board to basically prove up at a hearing that someone is a substance abusing licensee. I discussed with the committee, and I'm going to again hear with the board, some of the concerns with doing that. It puts a lot of work on staff for us to have to try to prove that case. And it really doesn't have public protection at the forefront. It does definitely provide meaningful opportunities for ensuring the licensee, has this issue or doesn't. But from just a cost perspective, a public safety perspective, it just isn't what I would recommend that we do. I did provide some information in the meeting materials, and I provided it to the committee with a breakdown of what the other DCA boards are doing on the issue. And for the most part, most of the DCA healing arts boards are actually using that presumption model. So if your underlying conduct involves drugs or alcohol, we're going to presume that you're a substance abusing licensee unless you can demonstrate to us otherwise. And that would be either through mitigation while we're negotiating a stipulated settlement, or if the matter proceeds to a hearing, bring it to the judge and convince the judge that, you're safe and we don't need to use these uniform standards. So that was the recommendation I made to the committee, was that consider pivoting that stance a bit, and instead of going with the prove up at a hearing model, instead move to the presumption model that the majority of DCA healing arts boards are already using. The committee agreed with that recommendation and then made a formal motion or recommendation up to the full board to consider that stance. So just asking the board for concurrence there. I don't need a formal motion. It's just if there's opposition, I'd like to hear about that before we craft the language and bring it in July.
Was there a sense, I don't recall if we had any time frame on the, again, back to the delay in being able to enforce the uniform standards, of like to have an evaluation done, or the delay if you have to prove it up at a hearing?
Those are certainly the part of the consideration there. So with the clinical evaluation, the way, when you think about the way it's presented, it's like, okay, so you're going to test everyone. There's costs involved with that.
Very expensive.
It's very expensive, but you're also, every time the board's making a decision on a case, it's conditional because you don't actually know what the outcome's going to be. You're pegging it on that evaluation, and you may or may not do something later. So there's a big workload on the staff side too, managing that. Proving it up at a hearing is also very expensive because we would have to go through those, the BPC 820 evaluations on people to try to prove that they're substance abusing licensees. And, you know, we basically take something that, when you're talking criminal conviction type cases, they're the easiest cases that we typically have and the most cost effective because it's a paper case. You're proving the conviction occurred, you know what the underlying circumstances are, and you're evaluating what the appropriate evidence would be. This option that the board had approved in 2014 would require us to go one step further and then basically reinvestigate the underlying circumstances to prove something that's apparent in the documentation. So that's why, for those two reasons, like with both of those issues, there's more cons than pros, I would say, and that's why our recommendation is to move with the presumption model. And Sabina's pretty well versed in them as well with her other healing arts boards, and that's what her recommendation was as well.
It shifts the burden, right?
Yeah.
And it also, I think it also helps our enforcement process go a little faster without that extra burden of a clinical diagnostic evaluation and cost and that kind of stuff too. You know, they might end up having to get a clinical diagnostic evaluation perhaps in part of an order or something like that, but that's later on in the process.
I'm in support.
Yeah.
Yeah, I'm in support.
Appreciate that. So we will work on, that was kind of the last remaining piece we have on that proposal. It's in a lot of different pieces. One good news coming out of the regulations unit is they've kind of started up a disciplinary guidelines working group. So we're looking forward to participating in that as well, because we're working to finalize language, but then we can also collaborate with some other programs and see what they've also got in the works, and hopefully craft even a better regulation. The goal is to be able to bring language to the board at the July meeting so we can formally enter the regulatory process on this.
I think we meet on Tuesday, the first UG, the first meeting for disciplinary guidelines. We'll be meeting on Tuesday.
Excellent. Does that conclude
That
item
does.
13? Any public comment on agenda item 13? Hearing none, we will move to agenda item 14, the report from Dr. Daniels on the licensing committee. You have the floor.
Okay, so we met on March 27th, and just briefly, kind of overall, we have 3 regulations in initial filing, we have 3 in production, and then we have 5 in the concept phase, just as a background. This last meeting, we focused discussions on temporary license, virtual care, and AI. We talked about those the last board meeting, and then we kind of sent it back. So I think the conversation was good. At this point, we're sort of fine-tuning the language for virtual care, trying to make sure that it's operational and it's very clear. We discussed AI, and even in consideration of, was it 1979, the bill? We still are continuing our conversations, and the staff had brought forward language, so we're trying to refine that, and we're leaning towards creating a separate AI consent form. There's some considerations to consider with it, and we want to sort of, there's language as far as AI proofing your regulations. So it's for the protection of the patient. There was just too many details that we couldn't really fit into the regulation. And just off the top of my head, a quick example is obviously the patient has the right to decline AI, but there needs to be clear parameters that they can decline in the middle of whatever they agree to, and also that they need to be clearly notified that their care may not be as good without the use of AI. So there's a lot of details that need to go into that. So we were kind of leaning towards a separate AI consent form, so that we're not regulating AI. The specifics we can't, but our job is to kind of regulate ethical integration of AI into clinical practice. A lot of good information from the Federation of State Medical Boards, who have a kind of executive summary on navigating responsible and ethical incorporation of AI into clinical practice, which there's a lot of highlights from there that we started adding into a separate document. So it's a great guideline. So we talked about that. We're hoping to have in the summer specific language on all three, virtual, temporary, and AI. As far as the temporary license, one of the main changes, we changed some of the language from restricted license to a limitation, because restricted sounded a little pejorative. So it would be a limitation in their license based on the parameters that they don't meet California CE, whether it's, PT, dermatology, or whatever. So just a little tweaking of that language. And then with virtual care, really started nailing down initial requirements versus subsequent requirements. We've added in a clause for unplanned virtual care, in that emergency type basis where you can't properly inform them, but they need that care virtually. And so, putting it, we have a clause in for that and what that means. And then if there's any follow-up that you do need to make with a patient in a reasonable amount of time, as many of us know, if a patient's like, dizzy when they call, they're not going to remember everything you said. So it would be, a follow-up. So just trying to make initial visit versus subsequent safe for the patient, but manageable and operational for the licensees. So we had a conversation on that, and we're working on clarifying that. So we're hoping to have those three for summer, and we're going to work offline in mid-May to really kind of spend some time nailing down the language to have that ready to go. Ms. Cruz, did I miss anything?
No, you hit.
So if anybody has any questions, there's no motion. Again, there's a little bit more digging into making sure we cover all the bases and get it right. So that is my...
Continued heavy lifting on the part of the licensing committee. That's great.
What I will say is on the AI side of things, I do appreciate kind of how we've taken that step back. So I know when we first had those discussions, it was just a lot.
Yeah.
Right. It was, and I think even that point in time of the technology and kind of how different practices were already using it, we didn't know how to approach the scope. So I completely appreciate kind of how we've kind of pared it down and really just focused on, all right, protection of the patients and what makes sense operationally for our providers.
Yeah. A lot of great work there. I mean, that's a lot of packages that you have out of our packages. A lot of them come out of that committee.
Yeah,
That's
and
great.
unfortunately, the curriculum package is still in production, but we've had a lot of other stuff like Sunset and stuff. So that's kind of the next one, hopefully, that we'll move through.
Good stuff. Any other questions or comments from the board? Dr. Daniels or Ms. Cruz? Okay, hearing none. Public comment for agenda item 14. Okay, we will move on to future agenda items. This is where you get to suggest
Yeah, I have.
future items to be put on the agenda.
I have some.
So,
I wanted to put on the agenda addressing the public comment for the certifying CE on not the content, the operational side. So I wanted to put that on there. I think we need to discuss that. And then also, I wanted to put on there building the language around the details of authority for site inspection, since we're kind of moving through kind of our cleanup phases of all the regulatory packages, and getting the staff. We're hoping to have really more of the resources to start being more proactive. So anyways, those were the two that I had.
good suggestions. Any others? Future agenda items?
I think there'll be plenty that comes out of our discussion this afternoon.
True. Nothing pressing? Okay. All right. Any public comment on future agenda items discussion? Hearing none. Okay. We will now proceed to closed session. After closed session, the board will engage in a strategic planning session and then recess until Friday, April 17th, 2026 at 9 a.m. Note the strategic. And there will not be a webcast for the strategic plan. But if you want to come on down here and join us, you're welcome to. Having said that, we will now move into closed session.